If you run a med spa, IV hydration clinic, or wellness business, you've probably heard the term good faith exam. But here's the truth, most state boards don't even use that phrase. What regulators actually care about isn't a buzzword. It's whether a qualified provider evaluated the patient, made a clinical decision, and documented that encounter properly. That's the real standard, a valid, well-documented patient-provider relationship that meets the expectations of medical and nursing boards. In our industry, the phrase good faith exam has become shorthand for a pre-treatment evaluation that happens before services like injectables, IV therapy, or weight loss medications. But most boards don't formally recognize the term at all. They recognize the process, the standard of care. That means a licensed prescriber reviewed the patient's history, assessed their clinical status, and documented a legitimate plan for care. That's what counts, and that's what will protect you in an audit or an investigation. Over the past year, state boards have started calling this out directly. Boards in states like Arkansas, Ohio, and Florida have issued written statements saying that clinics are misusing the term good faith exam and falling short of what's actually required. They've clarified that registered nurses cannot diagnose, prescribe, or establish a patient-provider relationship. Standing orders are not substitutes for individualized care. And one-time GFEs or templated waivers don't meet the standard of care. If your documentation looks like a checklist or a waiver instead of a medical note, it's not going to hold up under scrutiny. So who can actually perform a good faith exam? Only licensed prescribers, medical doctors, doctors of osteopathic medicine, nurse practitioners, or physician assistants. RNs and estheticians can assist with intake and documentation, but they can't diagnose, prescribe, or establish that patient-provider relationship. This is an important distinction because when regulators say licensed provider, they mean someone with a diagnostic and prescriptive authority, not just a clinical license. That difference is what determines whether an exam is compliant or not. So can a good faith exam be done virtually? The answer is yes, as long as it's done correctly. Most states allow telemedicine clearance exams if they've been conducted through live video, performed by a provider with prescribing authority, and are fully documented in the patient's chart. That means no chat-only exams or pre-filled forms, and no click-to-clear shortcuts. A compliant telemedicine exam should verify the patient's identity and location, be conducted on a HIPAA-secure platform, and include documentation and consent stored in the chart. If you can't defend that encounter as a legitimate medical evaluation, it's probably not compliant. So let's talk about shortcut models, because this is where many clinics get into some trouble. Some vendors advertise fast virtual GFEs or quick telehealth clearances. But if you read the fine print, many of them specifically say that their exams do not create a patient-provider relationship. That means that if something goes wrong, the liability falls back on your clinic or your medical director, even if they never saw the patient. In other words, the order looks legitimate on paper, but there's no real oversight behind it. Convenience doesn't equal compliance, and regulators are now taking notice. A compliant good faith exam follows the same process as any legitimate medical encounter. It starts with patient intake and history, includes a risk assessment, then a physical or telemedicine exam performed by a prescriber. The provider makes a clinical decision, documents it in the chart, and signs treatment orders. The note should look like any other SOAP note: subjective, objective, assessment, and plan. There's no such thing as a lighter or shorter GFE note. If your documentation wouldn't pass as a real medical record, it won't protect your license as a good faith exam. Regulators are already moving away from the whole good faith exam terminology altogether. They're emphasizing ongoing, documented patient-provider relationships, not one-time clearance exams. That means that annual updates, follow-up documentation, and living protocols that reflect continuous medical oversight. Clinics that continue treating this as a checkbox will get left behind. Clinics that build compliant, defensible systems will lead the next phase of growth in aesthetics, wellness, and IV therapy. At GuardianMD, we don't sell buzzwords. We build compliance infrastructure. Our licensed MDs, NPs, and PAs perform legitimate exams, establish valid patient-provider relationships, and take responsibility for patient outcomes. That's the difference between a checkbox and compliance confidence. We help you protect your license, your business, and your patients, while giving you the structure to scale safely. If your clinic needs a compliant good faith exam or telemedicine clearance solution, visit GuardianMD.com to learn more. Compliance isn't a barrier to growth, it's the foundation of it. I'm Dr. Chris Seitz, and remember, stay safe, stay compliant, and keep building healthcare the right way.